Hi there, I'm Dr. Dane Donahue and I'm one of the doctors here at Wellness Solution Centers, and I'd like to formally welcome you to our office and tell you what's going to happen in just a few minutes when one of the doctors comes in to do your evaluation. There's basically 4 rules of engagement, things that you need to know about our office to get the most out of your experience here. The first rule is to understand that chiropractic is different than medical care. The biggest difference is chiropractors don't prescribe drugs, nor do we want to. The chiropractic approach is unique because it's a natural approach that doesn't use drugs. What we do is we look for the underlying cause of your problem. We don't just focus on the problem itself. The problem that probably brought you into this office is some unwanted health complaint, something like pain or some discomfort or some problem that you're having with your health. And we feel it's important not to numb those with medication, but to really look at the underlying cause of the problem that's creating this unwanted health condition. So the thing we want you to understand is that we deal with something called your spine and your nervous system. Your spine and your nervous system are extremely important to your overall health. You have a brain and a spinal cord that's the first organ system that formed in your body, and it's the communication system of your body. The chiropractor is concerned with the job that that nervous system is doing. Your nervous system is protected by 24 bones that move. Those bones need to maintain a normal alignment. So when one of these vertebrae rotate or misalign out of position, we call that a subluxation. And I know that's a big word, subluxation, but it just means misalignment. When a vertebra dislocates or a bone dislocates like your shoulder, it pops completely out of joint. When something subluxates, it misaligns, and when it misaligns, when we're talking about the spine, it can also grab or pinch or compress one of these delicate nerves as it's passing out through the spine. When that happens, the brain does not communicate with the body the way it's designed to. So just like I'm trying to communicate with you now, if I put my hand over my mouth, you're not really going to understand what I'm saying. When the spine is subluxated, 2 things happen. The nerves get impeded, so the messages from the brain can't get where they're going, and also the messages from your body to your brain can't also get to where they're going. That's one thing. The second thing is when a vertebra misaligns and stays there, you can develop something we call degeneration. Degeneration is arthritis. The spine starts to wear out, much like the front end alignment of your car. Your tires will wear differently when there's a misalignment in your front end. So too will your spine wear abnormally and you'll develop arthritis or degeneration. So rule number 1, remember that chiropractic is different than medical care, and we're glad you're here because we're going to focus on the underlying cause of your problem. Rule number 2 is that you're going to be receiving a thorough evaluation in just a few minutes. Our office is different in that we employ something called the wellness score. And a wellness score is going to take all of your physiology, your function, things like your x-ray findings, things like a nerve scan that we're going to do, things like a functional movement screen where we're going to look at how your body's moving, your blood pressure, your resting heart rate. We're going to put all this into a wellness score that's going to give you an overall grade to see how you're doing with your health, and it's also going to help us pinpoint what are the areas that are creating problems in your overall function in your physiology. The third rule is really important. You're the boss in this office. You'll decide how far you want to take your care. I look at care personally like I look at my dental care. So when I brush, when I floss, when I see my dentist, it's amazing, but my teeth are in pretty good shape. 43 years of life, I've only had 1 cavity. I don't think that's by accident. I think because I brush, because I floss, because I see my dentist on a regular basis, I've taken really good care of my teeth. You know, we have a saying in this office, if people wore their spine and nervous system on their face like they do their teeth, they'd take better care of it. But because your spine is buried deep inside your body, you can't see it. We're going to take a look at that spine and see how it's functioning, and we're going to ask you to start taking better care of it. In 22 years of practice, I've seen a lot of x-rays and MRIs, and what I can tell you with absolute certainty is that our spines are not aging and functioning the way they're designed because we're just not caring for them on a regular basis. So you're the boss. Many of you have come in here with symptomatic complaints, but we're more concerned with what's causing those symptoms. We're going to ask you to do things outside of the office to help us with what we're doing inside of the office. So we want to take a look at what are your behaviors, your choices that may have created the very problems that brought you into our office. So things like, how are you sleeping? What predominant posture are you in all day? We find that 70% of the workforce sits for a living now. And when you sit, you're putting a tremendous amount of strain on your lower back, your neck, and your shoulders. And if you're doing that for hours on hours a day, that creates very predictable problems in the spine. So we'll be looking and asking you what your predominant postures are. We'll be asking what you eat every day, how much stress that you're under. You came to this office maybe with a symptom, but the great thing about this office is that we're going to look at your overall health and well-being, and if you choose, we can help you with some of the other areas of your health that you may not have even thought about before you came into the office. And then the final rule is we want you to understand that you'll schedule 2 visits after today's evaluation. The first visit is something that we call a report of findings. So the report of findings is just that. We're going to report to you what we found on your wellness score. We're going to take a look at your x-rays together. We're going to look at your nerve scans. We're going to look at your wellness score. And we're going to show you why you're getting the symptoms that you're getting, if that's why you came in. Or we're going to take a look at what your overall goals are and what we need to do to change your physiology so that you can meet your overall goals. So for example, if you came in and you want to get off medications that you're taking, if you came in and you want to lose weight, if you came in and you want to have better core strength and flexibility, if you want to lose those unwanted symptoms that you're getting, we can help you with those goals, but we need to first identify where we need to start from. And then the second appointment, probably the most important appointment you'll ever have in our office or any chiropractic office, is something called a WOW, and that stands for Wellness Orientation Workshop. So the word doctor comes from a Latin word that means teacher, right? So doctors are not only meant to treat patients or people, but they're meant to educate people. I guarantee you it's the things that you're doing outside of our office that have led to the very problems that brought you into our office. So we want to really take a look and educate you on those things, those behaviors that you can start to do to put yourself more in line with somebody who's going to have good health. So in wrapping up, I want to again welcome you to our office. One of the doctors will be in just a few moments, and we'll want to thank you for choosing Wellness Solution Centers.